I'd like to say thank you for those of you who are tuning in today. My name is Megan Weigel. I'm a doctor of nursing practice and advanced registered nurse practitioner in Jacksonville, Florida. I have an integrative medicine practice called First Coast Integrative Medicine, where I care for people who live with neurological conditions and symptoms. Based on the current public health crisis, as well as the emails and social media comments I've received today, I've just felt really called to put together this presentation that I hope you'll find educational. There's a ton of information, but hopefully you'll be left with feelings of being given reliable sources of information, as well as ways to manage anxiety that will arise as the next few days go on. So I'd like to talk about the coronavirus and how to stay healthy and well. I'll give you facts about the coronavirus as well as tips for high-risk populations, how to protect your family, travel concerns, and then integrative medicine, lifestyle, and mindfulness meditation techniques to improve your immune system health. First, facts about the coronavirus. I'll talk briefly about the background, how it spreads, the symptoms, prevention and treatment, what to do if you are sick, and then what to do if you are a high-risk population or caring for someone who is in a high-risk population. The coronavirus is being called COVID-19. It is caused by a new coronavirus that was first detected in China. These coronaviruses are common in people and many animals, including camels, cattle, cats, and bats. It is suspected that the first transmission was animal to human, but now spread is definitely person to person. This coronavirus has been deemed a pandemic according to the World Health Organization. However, what we don't hear about on the news is that serious illness occurs in only about 16% of cases, and most people will recover at home uneventfully. Our greatest mission is to prevent the spread of the disease, because community spread and widespread transmission in the US is likely. The number of cases will increase rapidly over the next few days to weeks because the requirements to be tested will now include simply being sick or having a doctor's order. So as I see it, I can imagine a person having heightened anxiety and just wanting to get tested. These people may not necessarily have symptomatic disease, although it is certainly a good thing for us to know that they have the disease so that they can prevent the transmission to others. The coronavirus spreads from person to person in close contact within about 6 feet. It spreads through respiratory droplets from an infected person who coughs or sneezes, and people are most contagious when they are the sickest. However, it is possible to spread the disease if you are asymptomatic, which is why there is a 14-day suggested quarantine or isolation in order for people who are traveling from level 3 areas that I'll discuss later. Spread can occur by touching a surface or object that has the virus on it and then touching the nose, mouth, or eyes. So we really need to think about how often we may sit with our hands near our face or touch something and rub our nose or our mouth or our eyes, and just try to be more aware of what we're doing with our hands towards our face so that we can avoid transmission that way. Symptoms typically appear about 2 to 14 days after exposure, and they're most commonly fever, cough, shortness of breath, or tiredness. I would encourage those of you listening to read Tom Hanks' post about his recent diagnosis, as well as that of his wife Rita, as they are in Australia. But basically they had symptoms of very mild illness and decided to go ahead and get tested given their recent travel and the current crisis. Less common symptoms are aches and pains, nasal congestion, runny nose, sore throat, and or diarrhea. As I mentioned previously, about 80% of people recover from the disease without special treatment, and some people have the infection but don't ever get symptoms. They can still transmit the disease, however. So what can we do to prevent it? Your mom always told you to wash your hands, and it's so important right now. You need to wash your hands with soap and water frequently for at least 20 seconds. And what they teach my toddler in Montessori school is to sing happy birthday while someone is washing their hands. You should especially wash your hands after being in a public place, blowing your nose, coughing, or sneezing. And if you don't have access to soap and water, you can use a hand sanitizer that has at least 60% alcohol. You're going to hear the term social distancing a lot, and this is the practice of avoiding close contact. So you're staying 6 feet away from people if they're spread in your community. You're staying home if you're sick. You're also covering your coughs and sneezes. So think about coughing and sneezing into your elbow crease instead of into your hand, or sneezing into a tissue and throwing it in the trash. Avoid touching your eyes, nose, and mouth after you cough or sneeze, or after you touch frequently used objects like doorknobs, keys, keyboards, shared keyboards, elevator buttons, things like that. Clean and disinfect frequently touched surfaces daily with EPA-registered household disinfectants or bleach solution. This is one area where vinegar and water that many of us use in order to reduce toxicity is not going to be effective at killing the coronavirus. According to the World Health Organization, only wear a mask if you are ill with COVID-19 symptoms or looking after someone who may have COVID-19. There really is a worldwide shortage of masks, so use them wisely. There is no antiviral treatment for COVID-19. Treatment is supportive care. So what do you do if you're sick? The CDC tells you to call your doctor if you think you have been exposed to COVID-19 and develop a fever and symptoms of respiratory illness. You should stay home. That means no work, no school, no public places, no public transportation, and this includes Uber and Lyft. Think about how many people get into those cars after you or before you. Stay away from others, limit contact, even with your pets and animals, because while transmission from human to animal has not been recorded, that is possible, and we know that there is an animal to human vector. Call ahead before visiting your doctor, your health department, or the ER if you think you've been exposed to COVID-19. Wear a face mask if you are sick, and do not share personal household items. So who's at high risk? Well, pregnant women may be at higher risk and at risk for more severe illness, but this is theoretical because there just hasn't been any data to tell us that that's the case. Most confirmed cases are in adults, not children, and epidemiological data from the Mediterranean respiratory virus and SARS tells us that children do not develop as severe disease as adults do. However, again, there's not enough data to know that for COVID-19. Higher risk populations are identified as older adults, people with serious medical conditions like heart disease, diabetes, lung disease, and cancer, and people on certain immune modulating therapies for autoimmune diseases. So you say, I'm at higher risk, what should I do? Well, be smart. Stock up on supplies like over-the-counter medications and medical supplies, as well as non-perishable groceries. Talk to your healthcare provider, pharmacy, or specialty pharmacy about getting extra medication or having medication delivered in case you need to stay home for a period of time. You can ask a local pharmacist for a vacation override in order to fill your medication before the next fill is due. You can also talk to your specialty pharmacy about, or your regular pharmacy about getting a 90-day supply of medication instead of 30-day supply. This is especially important for people on specialty drugs that require prior authorizations and sometimes more than once a year. It's really important to stay in close contact with your providers, pharmacies, and specialty pharmacies about these medications. Avoid crowds. This includes gyms, fitness classes, regular classes, church, community meetings, conferences. It's just the smart thing to do. Certainly, the decision to attend one of these opportunities is up to you. But to me, the smart decision is to stay away from opportunities to contract the disease. Avoid all non-essential travel, especially long plane trips and cruises. And have a plan if you get sick, which includes a plan for care if your support partner also gets sick. So you might say, well, I take immune modulating medication. What should I do? Well, you definitely want to talk to the prescriber of your medication to find out the best course of action. These medications are commonly used for autoimmune diseases like rheumatoid arthritis, lupus, psoriasis, multiple sclerosis, Crohn's disease, just to name a few. Also, folks who are currently being treated for cancer may be on immunosuppressive medications. My particular specialty is multiple sclerosis, so I can speak directly to that with confidence. If you have multiple sclerosis, recommendations from the National MS Society's National Medical Advisory Committee are to continue disease-modifying therapies and to discuss specific risks with your MS provider prior to stopping the therapy. If for some reason you are currently in transition from one therapy to another, specific risks of cell-depleting therapies or those that carry warnings of potentially severe increase in disability after stopping should be discussed prior to making a change at this particular point in time. These guidelines have been endorsed by the Consortium of MS Centers and also members of the MS Coalition. How to protect your family. Well, in addition to the mentioned preventive measures, it's important to create an emergency contact list and a list of community aid organizations. You can also choose a room in your home to identify as a sick room, get disposable gloves to handle laundry and other items used by a sick person with COVID-19, and just have those on hand. I'm located in Florida, and I have what's called a hurricane box in my house. It's a big Tupperware box filled with all the things that we may need during a hurricane if we lose power for several days, like non-perishable foods and toilet paper and cleaning products and Kleenex and batteries and things like that. So short of the batteries and the flashlights, it may be a good idea to just create a sick box so that you don't have to worry if someone were to be exposed to COVID-19 or develop the disease. Stay up to date on school closures and emergency work plans, as these seem to be changing daily. Again, practice the mentioned preventive measures, including those for travel, which I'll discuss in a moment. Plan for alternate childcare arrangements in case of school closures or for alternate work plans. And consider avoiding crowds as if you were at higher risk, depending on your anxiety level. So I've gotten just a myriad of texts and emails today from friends and family and patients sending me screenshots of tweets and videos of things they've heard on the news and asking me what they should do, and I keep giving them really the good basics. But ultimately, if your anxiety level is going to be reduced by taking extra precautions, then there's nothing wrong with taking those precautions. Make smart decisions for your family and do what's best for you. So the Center for Disease Control states, quote, "You will be asked to stay home for a period of 14 days if you left an area with widespread or ongoing community spread, considered a level 3 travel health notice," unquote. These areas of level 3 travel health notices are China, Iran, Italy, and South Korea as of March 12th, 2020 at 3:58 a.m. when this presentation was created, Eastern Standard Time. You should reconsider optional travel, including long plane rides and cruises. Consider whether COVID-19 is spreading where you are going. whether you will be in close contact with others or are at higher risk of illness. And make sure you have a plan for taking time off work or school in case of exposure or COVID-19 illness, or in case of changes in guidelines as instituted by our government organizations, such as changes in travel advisories. Moving on to some things that are a little bit more positive. How can we prepare our minds and bodies for a threat that really causes significant anxiety, and this in turn increases our risk for illness? Pretty basic lifestyle changes or lifestyle implementations. Make sure your diet's healthy, especially right now. Eat a plant-based whole foods diet. Stock up on frozen veggies and fruits if it makes you feel better to do so, as well as non-perishable whole grains if you're eating grains. Consider supplements that support the immune system against viruses, and these include high-dose vitamin C, vitamin D3, quercetin, zinc, and magnesium. It's super important to talk to a healthcare provider who knows you and is well-versed in supplements and botanicals before starting any new supplements because of the risk of disease, drug, or supplement interactions. For example, people living with MS are not recommended to take high dose vitamin C for long periods of time. Keep in mind there's no evidence that these supplements prevent COVID-19. There's much more evidence for frequent and thorough hand washing, social distancing, staying home when you're sick, so on and so forth. As I mentioned previously, anxiety can increase your vulnerability to viral infection. So we want to do things that decrease our anxiety level. And from what I've seen in the past 24 hours from people I've talked to, I think it's really important to limit your news and social media time to 10 to 15 minutes per day, or maybe 10 to 15 minutes in the morning and at night, and only choose reliable sources to follow. If you have friends or family who feed panic or anxiety, kindly tell them that you don't have room for those thoughts right now. Choose to limit the contact or choose to end the conversation, and I'm not kidding about this point. It goes something like this. Hey, Mom, or Aunt Mary, or Uncle Joe, or my BFF, I'm trying really hard to stay positive right now. It's much better for my health. I trust my sources of information. Thanks for your concern. Let's talk later this week. You can even have this presentation up when you're having the conversation so that you don't falter on the script, because it can be a hard thing to do. Let's talk briefly about mindfulness and meditation. Mindfulness means being present without overreacting or getting overwhelmed. So be mindful when you're talking about COVID-19. Refer to this presentation, to the references that I cite at the end of the talk, and to the statistics. Be mindful when taking preventive measures. Consider what you're doing and know that you're doing something positive for your health and the health of your loved ones, rather than having a panicky attitude about cleaning or coughing into your elbow or washing your hands. It's just something new that you have to start implementing into your daily life. Meditation is different than mindfulness. So you can't suck out your thoughts, but you certainly can watch them without judgment. So take a look at what's happening inside your mind. Let it come to you and let it go. Consider a meditation during which you create a protective shield around yourself, your family, your home. And I'd love to share one with you right now. So when you're ready, you can come back to this or you can do it now. It's fairly easy to remember. Just want to sit in a comfortable position in which you can maintain alertness. This might be a seated position with your legs crossed or with your legs extended. Perhaps you're sitting in a chair or leaning against a piece of furniture. It's best if you're sitting and not laying down. And from this position, feel your connection to the earth. Feel your sits bones in the ground. Feel your heels or your feet near the earth. And as you lengthen your inhales and your exhales, scan your body from your toes to your crown, starting with your toes, going up your shins, your calves, to your knees, to your thighs, your pelvis, your abdomen, your heart, your upper back, your throat, your face, your scalp, the crown of your head. And breathe in fresh air to areas where you felt discomfort. So breathe in that fresh air and then exhale the discomfort far from your body. You can even watch it blow away in the wind. You continue to breathe in fresh air until all of your areas of discomfort have been cleaned out. And then call to mind images of yourself, your family and friends, and hold them in your mind's eye. And then start to build a shield from the ground up and around your loved ones like a house. Let the roof come to a peak, and imagine that that peak extends to the heavens. Say the following in your mind or out loud until you feel a sense of calm strength. I am safe and well. I am caring and kind. I am cared for. I am at ease. I am safe and well. Those I love are safe and well. I am caring and kind. I am cared for. We are cared for. I am at ease. We are safe and well. We are caring and kind. We are cared for. We are at ease. Let that shield, that house, continue to surround you and your loved ones as you open your eyes when you're ready. These are references. You can actually Google coronavirus, CDC, coronavirus, World Health Organization, coronavirus, National MS Society, to find these resources, since I'm not sure that I can hyperlink them on this video presentation. I'm not that tech savvy with this stuff yet. An article that I also found really helpful and calming today was from USA Today yesterday by an epidemiologist. The title of the article was, "I'm an epidemiologist. Here's what I told my friends about the coronavirus and COVID-19. You can still find that article online on USA Today's website. So thank you guys for tuning in. Please share this as you see fit. I hope that the meditation is helpful in at least calming some panic and anxiety that, frankly, it's just hard to keep from popping into your mind every now and then if it's not omnipresent. I wish you all the best. Be praying for everyone's health and safety in the coming weeks. And again, thank you very much.